Promundo has been working to engage men and boys for gender equality for some 20 years. A lot of that work for many years started off evaluating and developing program approaches at the community level, and particularly some of those with the health sector. And in 2015, we decided to look at where were we globally on engaging men in terms of unpaid care work. And we launched the new report just now, so the 2017. Our first report, State of the World's Fathers 2015, took a look at what's the literature, the research in terms of how much men are participating and the benefits when they do to women's health, reproductive health, maternal and child health, reductions in violence. We looked at what it means for children in terms of child development, men themselves, and societies. One big overarching piece is while there's a lot of development, there's a lot of research from the global north, not nearly as much from the global south. Things that we can affirm is that when we involve men in thoughtful ways around maternal and child health, we see results that women feel safer in delivery, feel more supported, and in some settings are more likely to go for the needed care that they need in terms of antenatal visits and also visits post-birth. We also looked at the issue in the first version of violence against women in the context of pregnancy. And in a couple of settings, including Brazil, there's some data that suggests between 1 in 5 and 1 in 3 women experience some violence from men during pregnancy. So we also thought it was important to look at that. Resounding conclusion was that it matters to engage men, but it's also how we engage men. One of those approaches that we're doing is using the health sector. Our research finds across many settings that a lot of men do go to at least one antenatal visit, but we don't, in most parts of the world, use that visit as a time to engage men in thoughtful ways. Whether to screen for violence and therefore to offer services related to that, whether to inform men so they can be allies around maternal and child health, and also to sort of set the standard that we want men to be involved in the daily caregiving. The other conclusion that came out of our 2015 report is that we don't do much counting. We didn't really have there's very little global data on where men are in terms of doing the daily caregiving. So our kind of conclusion was what we don't count doesn't count. If we're not counting men's participation, then we're not thinking that it's all that important. 2017 report is much shorter. We have global data. This time we can look across the world at men's daily participation. We've got data from more than 100 countries. These are publicly available data sets that we were able to look at and do some analysis. And what do we find? There's been very little change. Globally, women are still doing 3 times the amount of daily caregiving compared to men. There's huge differences by region, and there's differences by poverty. The poorest countries in the world, that ratio of women's unpaid care work to men is even higher, close to 6 times. The most developed or richer countries in the world is about 2 times. So the conclusion is nowhere have we reached equity, but certainly development, multi-pronged policies make a difference. So what are we recommending? Changes in social norms so that men and boys see themselves as equal caregivers. We think that a lot of these norms are also, or we have data that suggests these are also a lot of the norms that drive men's violence against women, and that drive both parents' use of violence against children at times. So social norm change, parental leave certainly matters a lot and needs to be, for the most part, non-transferable, needs to be fully paid, and we aspire to the idea that it should be equitable. If we want men to do half the caregiving, we have to set the standard from the start that we value men's caregiving as well. Never taking days away from women, but adding days for men. Third, we see the need to scale up parent programming. There's really good evidence. Some of ours, we've recently done a randomized controlled trial in Rwanda with father training. So about 11 of the sessions were fathers only, 5 sessions with the couple, control group and an intervention group, almost 1,200 couples. What we found 9 months after the intervention ended was women reported about half the rates of violence from a male partner if he participated in the group. About a third reduction in both women and men in terms of violence against children, increased support by men of contraceptive use, and women reporting his increased support of her contraceptive use, women's reports of men doing more of the daily caregiving. Women's time use didn't change, so it suggests that men are doing some things, but women are either still doing them or supervising or multiple things, but we didn't see that women's time burden reduced at all. Those kinds of approaches, a multi-outcome kind of parent training approach, which we've seen in some other countries and other interventions as well, we think need to go to scale. And the last point that we make is the importance of bringing the engaging men in unpaid care work into existing poverty alleviation programs, cash transfer, women's economic empowerment, thinking about the kinds of universal income supports that the lowest income families need, that we can't do these things in isolation. And certainly from what we know about economic stress, from what we know about women's economic disempowerment, we do think there's a very powerful engine if we can both engage men in doing the daily caregiving, which helps drive the norms for men accepting equality, and we think that also contributes to violence prevention. And there's some evidence that suggests it also gets men to be more involved as reproductive health partners. As they're more engaged with the children they already have, some data suggests that they become more involved with a partner in planning or postponing or deciding not to have more children. So that's where we are. There's a lot to do. One step forward in interest in the topic, 2 steps back in terms of where we are in inequality.